My name is Laura Runcie, and I'm delighted to be hosting this session, the first in a revamped series of CCCN's Exploring Cardiovascular Nursing Journeys. In this revamped series, we invite you to join in monthly conversations I'll be having with nurses from across the country in a variety of roles and stages of life. Unlike the original panel discussion I had the pleasure of moderating in February of 2024, which is available on YouTube, and included 3 very different cardiovascular nurses from 3 different provinces telling their stories in one session, this fall I'll be diving a little deeper through one-on-one conversations. You might be wondering why this series took a pause and is now being relaunched a year and a half later. Well, also in February of 2024, I had the pleasure of adding a baby boy to our family. And while I'm a big advocate for nursing as a career path that can be very accommodating to family life, my personal work-life balance has been, by design, heavily skewed towards family since then. So if you've been waiting for more explorations in cardiovascular nursing journeys since 2024, I'm sorry for the delay and thank you for your patience. If you're new to the program, welcome. On behalf of CCCN, we are thrilled to have you here. Our goal through this series is to explore the origin stories and career paths of a variety of cardiovascular nurses, because the options within the realm of cardiology are endless. And for nurses, it can seem both limitless and daunting. No 2 nurses have identical journeys, and we should use those stories to encourage and inspire one another. So whether you're perfectly satisfied in your current role and career plan, or you have no idea what you're doing or what you want to be when you grow up, you're in the right place. So let's get started. Holly, how are you today?
Hi, Laura. I am very well. Thank you for having me.
For coming. So Holly is joining us from the province of Hope Restored, which, to be clear, is New Brunswick. I have personally known Holly for my entire nursing career. We were half partners for a while. She was my manager, and she's the one who invited me to check CCCN out in the first place. I probably could spend 30 minutes just singing her accolades myself and telling you my version, it's probably a little romanticized, of her career journey. But that's not my story to tell. And we wouldn't learn as much if I tried. Plus, I'm not as funny as she is. So, Holly, when you were little, what did you want to be when you grew up?
A mechanic.
A mechanic. I love it. I wasn't anticipating that. I was thinking like a unicorn or an elephant or something like that. So
it was between a lawyer and a mechanic, but I realized I can't argue with people without crying. So I was like, mechanic.
Might as well fix people, I guess, instead.
Yeah.
So now we're going to get Holly to give us the kind of a run through of her own career journey. And throughout the session, if you guys have any questions, feel free to like throw the hand raise up or throw them in the chat. I'll be watching from there, and I'll try to weave it in as we go. But I'll hand it over to Holly to give us an overarching run through of her career journey.
Thanks, Laura. So I guess I've already thrown a little bit of a monkey wrench, into the evening by answering with a mechanic. But yeah, I am Holly Knight. If we went with all of my credentials, it would be Holly Knight, PN, BN, RN, MN, and currently working on a PhD. So I like to every 5 or 10 years or so just collect another set of credentials. And of course, also there's CCCNC in there as well. Only for the pure sake of just keeping myself busy, because it keeps me out of trouble, and I get to learn a lot, and I love learning things. So my journey into nursing is a bit different. I think everybody has their own story to tell, but I certainly wasn't one of those kids that when you asked me when I was 5 years old, what do you want to be when you grow up? It wasn't a nurse. It was actually just never actually on my radar at all. Until I was 18 and had to come home and tell my parents that I was going to have a baby. And they were like, well, it's not the end of the world, but this child does not have to suffer the consequences of your actions. And, being in the late 90s, early 2000s that this happened, fair statement on their behalf, and motivating for me as well. So I took that time while I was growing a tiny human to kind of look and figure out what I was going to do with my life. And I knew it had to be something that was stable and that was going to be relatively quick, that I could get myself out working. So when I looked through the NBCC, so New Brunswick Community College handbook, definitely deviated away from mechanic and actually found the RNA program. So the nursing assistant program. And so it was that long ago. It would have been the year 2000, 2001. So I applied to the nursing assistant program at the community college, and I ended up getting in. So when my son was 6 months old, I started the 18-month program. And between the time I had applied and the time I actually started the program, the name of RNA changed to LPN. So I actually did start in the PN, the practical nursing program. I finished that program at the end of 2002. And I immediately knew that I wanted to go back and do my degree. I was still very young, just 20, 21 at the time, and had started on my career as an LPN, working kind of floating around the hospital, and immediately had way too many questions and had already recognized that I had met a limitation in that role as an LPN. But I knew that I had to at least get my son into school before I could actually go back and do the BN program. And at the time, there was no bridging opportunity for me either. So I had to do the full 4 years. So once Kobe started started kindergarten, he went back to school and so did I. I had a few years of experience under my belt. I had worked in general surgery. I had worked in the emergency department for several years. I still floated a little bit. I took on a role that was typically a male role, and I didn't really enjoy that it was only allowed for men. So I demanded I be allowed to do that too. So I worked as a float orderly for a little while, um, which gave me a great male urology experience, and casting as well. So I went back to school, and it would have been the fall of 2007. So I had been an LPN for about about 5 years at that point in time, and went into year one of the BN program with kids who were fresh out of high school. And I was a bit more of a mature student. 2007, I would have been 26. And I was a mom with a 5-year-old at home, and so very different from what it looked like to be in a class with kids straight out of high school. But it was a very unique experience, and it allowed me to learn a lot of really interesting things about people and also about nursing as well. So I was really, really fortunate to have that opportunity to really be involved in that way. I finished my BN in 2011, and I think that during my clinical rotations between 2010 and 2011, my acute and my complex clinical rotations is really when I discovered cardiovascular nursing. I did a rotation on a unit 5A North CCU, which is our local cardiac step down and coronary intensive care unit. I did that during my 3rd year of nursing school. And as soon as I walked onto that floor, I was like, okay, I'm home. It was one of the first times in my nursing career that I had actually felt settled. I was working internal medicine at the time, part-time, while going to school full-time. And I had some pretty great experiences learning from internal medicine. And I just felt like this was kind of a natural progression for me to go into kind of a specialty. And I knew at the time they typically didn't allow fresh new graduates to go into such a specialty area. I think many of us who have been nursing for a while know that they always wanted to do a couple years of like med surge, just to get your feet under you, get your more broad knowledge in nursing. But I had an advantage because at that point, by 2011, I had 9 years of LPN experience behind me. So I thought, okay, I'm able to maybe progress into this specialty. And oh, did I ever love it? I loved everything about the heart. And I still to this day, I'm such a cardiac nerd. I say this when I'm lecturing to people, I get asked to do guest lectures. But I'm so passionate about it. I was never a really strong student in high school, but once I went into nursing, it was a total flip for me. So my overall grade point average when I was in high school, because I was distracted by sports and social things, I was about a 69% overall average. And through college and university, I was around a 96%. So I really flipped that over. But it was because nursing really, really interested me. So I got into cardiovascular nursing from around 2011. And I also knew as soon as I graduated from my bachelor's degree that, yes, I was interested in doing a master's. And I think this is the point that my family and friends realized that I was just going to be in school forever. But hey, that's cool. I like to learn things. I paid my own bills, you know. Sometimes we make life choices that make our lives more difficult, but in the end, it enriches us really well. So that was what I leaned on when I explained to people that yes, I was going to go back to school. So I started a master's degree in 2012, um, looking at actually doing a thesis based in cardiovascular nursing. I did end up working full time. So it was the 2-day, 2-night, 5-day off rotation on 5A North CCU. That's where I was full time employed after graduating from my BN. And I did my master's part time. I got through all the coursework, started my thesis, and just really was struggling with writing. And I had, in this academic journey of mine, chosen to have two co-supervisors. And if anybody's ever done a thesis or has worked with co-supervisors in at the master's level, one solid piece of advice I would give you is to make sure that they have similar writing styles and work ethic, and they get along. So that was a lesson learned in life, and it really stalled my progress. So I did end up switching from the Master's of Nursing thesis stream into a nurse educator stream, which I really enjoyed. I really loved that. I love learning about teaching. I love learning about learning, curriculum design, a lot of community focus on that. And I was really able to hone in on my final project about teaching in the New Brunswick Critical Care Program, which again was really leaned on my cardiovascular nursing experience. So I finished that program in 2017. And one of the advantages of being in CCCN and having that cardiovascular nursing expertise was that I was able to tap into one of CCCN's greatest resources, Sue Morris. We love her so much. And she mentored me through that education piece while I was designing the delivery of some teaching from a case-based learning standpoint to the critical care nursing program, which had a cardiovascular focus. So really CCCN really helped me out with that, and being a cardiovascular nurse really benefited me in that journey in life. And I couldn't be more grateful for having that opportunity and just having that network of people surrounding me and supporting me. So I finished my master's in 2017. And while I was doing my master's in 2016, I decided to make a change career-wise from bedside nursing, having done it for about 14, 15 years. I decided I would try management. So a management opening came up on 5A North CCU where I was working. And I thought, you know what, I'll throw my name in the hat. Why not? I'll give it a try. You know, I like people. I think managing people will be interesting. I'll learn a lot about it, but I'm so interested in leadership. I learned a lot about it during my master's. And just the bedside, just working in an area where, as a cardiovascular nurse, you were autonomous in your practice. You were your own leader, but you also had to lead amongst, you had to advocate for your patients. You had to really fight for what was right for them, liaising and working with the cardiologists, the pharmacists, all of those folks that were involved. Those leadership skills were developed for me. So I thought maybe it's time for me to try and take a leap into management. Was it terrifying? Yes, absolutely. I was 34 years old when I took over a nurse manager role, and I was managing people who had mentored me throughout my entire career. So that was a little bit of a steep learning curve for me. The great thing about nurses is that they are very honest. So if they don't like the way you are doing something or the way you're handling things, they will tell you, and there's no mystery there. And I can't see you guys, but I know you're giggling a little bit because you know I'm being very politically correct about this. But I think that that's really was a huge part of my growth and my learning, was that I really got to work with some of these really strong leading personalities. And I mean, it's an intensive care unit, intensive care nurses, they have intense in their name. So you really learn about how to work with those different personalities. But one thing that I really wanted to do going into this role was just increase my specialty in cardiovascular nursing, because not only was I managing nurses and being a leader in that role, but I also was expected for program design and for implementing new and innovative ways of doing things. So I thought, if I understand things a bit better, and this helps with my curiosity and kept me out of school for a few years, um, I should really take on the challenge of doing the Canadian um, nursing cardiovascular specialty. So that certification exam, which I did it in 2020, because why not do that during a pandemic while managing an ICU? Again, my life choices, they are what they are. What that did for me was it really helped to solidify my knowledge. I really, again, was fortunate to have Sue Morris there as a mentor who was willing to kind of coach anybody who was doing that exam at the time. And it was really, really beneficial to have that wealth of knowledge, but also to work along with other people who were writing the exam. We kind of became a little bit of a group that worked together. And it really, that exam and getting that specialty just brought my knowledge level up just that much higher so that I was able to advocate. I was able to help in program design. I was able to say, this makes sense to do this. This does not. We really need to look at what the most current evidence is. Could we push to be doing this? It just made me so much more confident in my decision making. And even when something popped up where I had to talk with patients' families or anything along those lines, I was solid in my knowledge, right? It really helped kind of marry that expertise of what you learn at the bedside, what you learn in real life, and then also what the textbook says. It really helps to marry that. So that was really, really a really good endeavor. It was challenging for sure, but I'm so grateful for that. And having that on my resume, having completed my master's in nursing education, I decided in 2021 that it was a bit of a time for a change for me. I'd been bedside, I'd been in management, I'd been in the hospital setting and the clinical setting for such a long time. And I thought maybe it's time for me to put this master's of nursing education to work and check out the academia side. So I thought, okay, I will just apply for a 4-year contract at UNB St. John, which I'm so lucky is right on this almost the same campus, like geographically located right next to the hospital I've been working at for about 20 years. So I thought I'll apply there, 4-year term as an assistant teaching professor, and see how that goes. So I applied for the role. One of the strongest points on my resume that they'd actually talked about was my specialty in cardiovascular nursing. It was a significant gap that existed in the faculty. So when I came into that, there was the opportunity to guest lecture. There was the opportunity to just expand my knowledge, but also disseminate that knowledge to both the students and the faculty that I worked with, which was really, really interesting. And it just opened a lot of doors for me, having had that experience. When I talked with the students that I was working with, they had a bit of a fear of the cardiac stuff, as they called it, the cardiac stuff. They would say, I don't know how to read those rhythms. I'm so terrified. If somebody has an arrest, I'm just going to run. I don't know what to do. So having that background for me really helped to kind of talk to my students and just say, there's no need to be nervous. There's very simple things that we would do. And that is it. You start early, you have to walk before you run, right? Before you sprint. So that background in cardiovascular nursing really helped me with my teaching, and I still am very involved in it today. So to get to today, my 4-year term expired in August, but I was fortunate enough to get a tenure track position to stay at UNB St. John. So I will be continuing to work there as faculty. I still do enjoy picking up some shifts on 5A North CCU. However, I have also taken on some doctoral studies. I am currently doing a doctor of philosophy in education studies. So really just to learn more about how to teach better, how education works. So really going from the clinical side of things to the teaching side of things. And so just kind of diving more deeply into that. So that has pulled me a little bit away from the clinical, which I do dearly miss. And I do have to kind of look at picking up some more shifts once the summer is over, and I've just finished my comprehensive exams. So that was really an intense time. If anybody's done a PhD before. But yes, so that brings me to where I am today at the university, working full time, still teaching a lot of things that I have learned through my cardiovascular nursing journey. Just very grateful for everything that has happened along the way that has led me to where I am today. And I certainly would not be the nurse that I am today or the academic that I am today if I hadn't have had the experiences in cardiovascular nursing that I have had. I'm still involved in research. People pull me in on projects. The network is incredible. And I'm just so, so fortunate to be where I am. So that is, I think, my journey in a nutshell. Did I miss anything?
No, no, actually, I didn't realize how dark it had gotten in here. I just had the sunlight in the windows. That's awesome, Holly. I feel like you just checked off like 10 of the boxes I was going to ask you about as we went along. And I'm like, right, I guess we're done. This is the best guest speaker ever, because I was going to ask you to talk about how certification helped you along your journey, but you've done that. If anybody has any questions, feel free, like I said, to throw them in the box and we'll kind of bob and weave them in here. Holly, you kind of hit on it a little bit as you were going. You were talking about your support system and how you come up with these ideas, or they'd recognize, okay, this is the journey that Holly is on. And maybe it took them a couple minutes to catch up to the plan. But can you speak to the necessity of your support system and like choosing the right people to surround yourself as you go along that journey, both like family and coworker perspective?
Yeah, yeah, for sure. So I will say that I have been very, very lucky with my family. They have been extremely supportive of everything that I've taken on. I am a first generation university student. So my parents did not, my father graduated high school, my mother did not. So even being on the education journey that I've been on, they've been very, very supportive. My son has been tolerant of it all for sure, but he has learned a lot about that. So, and I've got siblings that are wonderful as well. Um, uh, Socially, and I think this is one thing that people have to realize is that, you know, having come up through my journey, and especially through like my 20s, there were certainly some friends that left, you know, that were frustrated with me not being able to go out on Friday nights or whatnot. But you know, you have to kind of figure out who's important to you and who's not. But colleagues, I think we all understand, working in healthcare, that nurse friends are so important, right? And you have to surround yourself with those good people because we see a lot of trauma. We experience some things that, you know, your banker friends do not understand at all, that you really can't even have these conversations. You're a lot of fun at parties because you have great stories, but at the end of the day, they think you're a little bit weird or messed up, right? Because you talk about things that are not normal to them. So I think honestly, having those nurse friends is really important. Having that network of nurses that understand you, that are like-minded. So, you know, in CV nursing, it's great because there's similar experiences. So you have the bit of that kind of shared trauma, but also shared wins, right? So you can talk about like, this was really cool. What we did today, that was so cool. So I think that that's really, really important, is just to make sure that you're surrounded by a great network of nurses and of people who get you.
Mhm. I 100% agree with that, because I think otherwise more people would leave. They would leave
Yeah.
the workplace if you didn't have that network. I see Sarah's hand there. I'll go to her in just a second. I worked a night shift with a young new nurse just this past week, and she's been out about a year, and she's really enthusiastic and really keen. And she's like, yeah, and I know I don't know everything yet, but I'm not in a classroom learning anymore, and I'm kind of getting bored reviewing my notes at home, and I want to keep learning, but I don't know how. I'm like, oh, now you need friends. Now you need to start learning with other people and things like that. So I think that nails that necessity of surrounding
Yeah,
yourself with other people who want to nerd out over the cardiac stuff with you, even though it's
exactly.
scary.
Exactly.
Thanks, Holly. It's nice to know you. I know we don't know each other that well, but it's nice to know of you and that kind of thing from our occasional interactions at conferences and that kind of thing. And as you know, I'm in clinical research, so I'm pretty excited about your research track, and also congratulations, of course, on everything that you've done. It's a refreshing story and stuff. So I might have missed it because I missed kind of the beginning, but did you say, are you doing your doctorate now? Is that right? And like, do you have a supervisor for that thesis, or I might have missed it? Like I saw something about that in the summary, unless I maybe read it wrong. Was that right? Or you just, yeah.
Yes, that is correct. Yes, I am. I just finished my comprehensive exam, so I'm about a year into my doctoral studies. Yeah.
Oh, congratulations. So you're like officially a candidate now, right? Or whatever it is. You know how
Close,
you
yeah.
like, yeah, yeah. Oh, that's great. And so did you did you make sure to get a better supervisor than in your master's experience? Because I can relate, like the worst thing is if you have two supervisors and if they have differing views, then you maybe encountered like when editing, it can be very difficult because the one says to do this and then literally the other one, or if they forget what edits they make, they'll re-edit and it can take some time, and then it's hard to catch them if they're busy and stuff like that. And yeah, it can.
Yeah, you're singing my song there, Sarah. So that was exactly my experience with my master's, was just the two differing opinions on things, and then also the re-edits, putting it back to what I originally had written. And like these are brilliant people that I was working with, and it was there's no slight against them at all. I was just very much like, I want to get this done. And they were like, well, we need this, we need that. And it was just a stage in my life where I wasn't ready to commit that much time to it. I wanted to get it done. So for my doctoral studies, I had to have a supervisor before I was even accepted into the program. So it involved me cold calling a few people by reading their research and then connecting with them. And I am ever so grateful to have found an amazing supervisor. He is incredible. He is super chill. We get along great. For my second comprehensive exam, he has put me off to somebody else who I will be working with, who is also great, but it's only one at a time. So yes, if anybody ever had any questions about that, feel free to reach out to me on the side if you're looking for any kind of advice on supervisors. Because
what's your topic on for your doctorate?
Yeah, so because I'm doing an education program, what I'm doing is actually looking at anti-discriminatory and anti-oppressive pedagogy in nursing education.
Great.
So really looking at how we educate our nurses to work in a very multicultural and somewhat oppressive healthcare system. Is very, very challenging times nowadays. And so how to educate them so that they go out into the world prepared to deal with that, and also to challenge the status quo and initiate some change. So.
Oh, cool. Yeah. Are you working closely with Dr. CCN's other big resource? Like there's Sue for the clinical stuff, and then for the research, there's, as she won the award a couple years ago for CCN's best researcher, Dr. Lisa Keeping-Burke. Are you working closely with her?
I work with Lisa every day.
Oh, that's lovely. So yeah, on your thesis and like research and stuff.
She's more of like an external advisory role for me.
Yeah.
A sanity checker, if we'll call her that.
Yeah.
How are you doing? I've lived this before. So yeah, lovely.
Yeah.
So grateful for that.
She's so great. Yeah. And she's impressive. Yeah, cool. That's so exciting.
That's a connection that I've made through CCCN, right? Is working with Lisa, having met her through that, and now as a colleague. But that's really the benefit of that being in that niche world of cardiovascular nursing.
Right. Yeah. And just so, when is your estimated date to defend your PhD then?
I'm quite a ways away still, so I'll probably be another two years before.
Well, it'll go by fast and stuff. And if you need some literal comic relief, I'm sure. Have you discovered the PhD comics yet?
Yep.
Yeah, because it's all in there about the editing and all that kind of thing. So it's like, oh my God. Yeah, it's like living it in the comics, right?
Yeah, they understand the lived experience for sure. So.
Yeah. All right. Cool. Congratulations.
Thanks. You guys bring up some of the great benefits of CCCN, that network. Literally everyone I've talked to who is engaged in CCCN for more than, say, 2 years, or even within that first year, it's that network that really seems to be what keeps them there, and like the great benefit they get there. And I'm wondering, Holly, so you've had the benefit of the network and the benefit of the CNA certification exam study group that CCCN offers through Sue Morris. Why did you join CCCN in the first place? Yeah,
so I really, really liked, again, the networking opportunity, but also the learning opportunities. So the supplemental education that's provided by being a CCCN member, the opportunity to go to conferences. If you haven't had the opportunity before, I think we all have, is just the ability to get in a room with like-minded people is so, so important to hear about what's going on, what other people's research interests are, the things that they're seeing that we don't even think of, because we live in our little niche world, right? We all live in our own little bubbles, and what's important to us is always there and right in front of us. But when you get into the broader picture of things and you're able to be in a room with other experts from all across Canada, all internationally, like CCCN had really presented those opportunities to me. So when I was introduced to it, I thought, like, why not? Why wouldn't you want to be a member of this? Because it's so incredibly valuable to be able to learn, to have that expertise right at your fingertips, right? And I see names, even on the list today of who's participating, where I'm like, I have worked with you before. I've read your research before. I've, like, it's so incredibly, it's a small world, but yet it's a huge world at the same time. And it really just, CCCN just really brings it together. So.
Yeah, I always find a conference is like both invigorating and like gives you new ideas and things you want to work for. It's also very validating because you're like, oh, these other people are experiencing similar trials and tribulations
Yes.
that we're trying here.
Yes.
And, a photo here to share, a little blast from the past photo. If you guys can see that. Did it? Oh, not that one. Did it come?
Oh.
Do you see? So this is a photo from not from my first conference with Holly, but my second conference with Holly, and it was one that a colleague and I we did a presentation at, and we were young new nurses, and it was a really, really positive and fun experience, and definitely a reason why I think I also love cardiovascular nursing for many of the same reasons that you've listed here. You have this network of people who you can connect with, and you can talk with, and you can learn things with, and you can carry it on that way. So Holly, what role then do you think, this is kind of shifting gears a little bit here, what role do you think nurses are going to hold in shaping the future and change? And you talked about how your thesis right now that you're working on has to do with how you can prepare nurses entering the workforce and to work. So what do you think that future will look like with these new nurses entering the workforce, and what do you have thoughts on the future of nursing?
I do. I do. Of course I have thoughts.
Yeah.
I think they're twofold. I think that I would be remiss not to talk about the challenges that people are going to face when they come into the nursing profession, right? Nursing is facing significant challenges nowadays with personnel, with working conditions, with all of, kind of the bull that we've had to fight since day one, being a female-dominated profession. And just those challenges, that the bureaucracy, the red tape, all of that. And trying to just have our voices heard and also just have a good, safe working environment. So those are the challenges that we are going to face, and we are going to continue to face. What gives me hope is the fact that we are getting stronger as a voice. We are getting stronger as a unit. Nurses are being more respected. We're seeing that respect coming out in the media. People are now actually aware of what we do. And they're learning every day more and more about the very broad spectrum of things that we do, right? It's not just at the bedside that we are doing. The bedside is so valuable, and I'm not saying just, but that's not the only spot where nurses are. And what I see for the future is that our roles are just going to continue to expand, is that we are going to we are leaders in what we do, and we are going to continue to be leaders in the future as well. Our role will become more advanced. And I think that it's really beneficial, all of the continuing education opportunities that CCCN gives, because the more we know, the better prepared we are for when our role expands. And I do see that happening. In some provinces, we're already seeing nurse prescribing happening. So we're going to see more of that coming out. And so it's just that more of a role outside of the hospital as well, in the community, public health, all of those roles that are really, really, really extremely important to try to keep people out of hospital, right? So those wellness within living with chronicity, all of that. So those are the roles that nurses will play in the hospital, in the community, in education, in policy, in government. Like, there's so many opportunities for nursing that we need to get our foot in everywhere, so that we can help with that decision making that's going to impact our careers our trajectory and our overall well-being in our careers. So
yeah, I think that's one of the reasons why I love these career journey discussions, is because it does start to highlight some of the diversity in nursing roles, and how each of these roles might celebrate a different aspect of, say, cardiology or nursing as a whole, whether it's bedside, whether it's teaching, whether it's management. But they all have like such a great potential there. And to your point, that stronger voice and and how that is building out in all of these different roles. And if you can get some collaboration between the two, or some continuation of knowledge, like the compounded knowledge of one person's career journey, and how loud that can make their advocacy voice is pretty amazing, as opposed to like jumping around too much. So what I have a feeling I know kind of the direction you'll go with this question, but what kind of a skill or activity do you think newer prospective nurses should be working on now, so they're ready for the future, for the next step, for whatever that looks like?
I think that it's twofold. So I think working on your resiliency is really important, because you are going into a very challenging career. So preparing yourself for that, how you manage challenges, how you practice wellness, how you do self-care. I think that is very, very important. But it also, you need to be able to feed your desire to for lifelong learning. You can't just think that you're going to finish school and that's it, you're done learning for life. No, you will learn something new every day. You have to be open for that. And also part of that resiliency is the fact that things are going to change, right? And so being adaptable to that change. I think I loved managing nurses. And one of the funniest things was like, we'd be in an intensive care environment and they can handle all the changes that are happening with a patient. Everything is fine. But if you steal their pen, it is the end of the world, right? Because they needed that pen. So nurses like the things that stay the same to stay the same, and they're okay with the things that they know are going to change are going to change. But just working on your resiliency, because as you progress through your career, you're going to be working with different generations. The way things are scheduled, the way things are done are going to change, and just really trying to kind of roll with it and be and adapt. It's a lot though.
I am personally feeling that right now. I just got back from an 18-month mat leave, and while I was gone, we changed our IV pumps, and we changed our IV equipment, and we changed our computer charting systems, and we changed our scheduling systems. And I'm finding it really hard not to be that cranky old nurse who's like, I don't like the computer charting and I'm not doing it. Like I am like, change is good, change is happening, and I'm way too young to be this cranky about change just yet.
Right.
So you're right, that adaptability, that changing. I thought you were going to lean a little more on like the continuing education aspect of like just taking them as you go, but you did actually, with the feeding the desire, the lifelong learning option.
Yeah, and I think the lifelong learning doesn't necessarily have to be academic. Like I have gone the academic route, and that is the way that I've gone. But you don't have to, not every nurse has to do that, right? You still can just sign up for extra skills sessions, go to a conference. If you get the chance to do, everybody hates e-learning, but there's, if you go to a webinar or something on those where you could sit in your pajamas with your sweats and your messy bun and just sit at home doing that, like that is fine as well, right? There is no pressure for you to go out and collect degrees by any way, shape, or form. It's just to continue keep your competency up and just keep that curiosity there.
I think there's a beauty in that lifelong journey of learning, where you're the active learner a lot of the time, but also there's the continuation in that where you become a teacher as well.
Yeah.
Whether you want to be or not, if you hang around long enough, you're the adult in the room, and now
Yeah.
it is on you to engage in the teaching. And I remember a particularly messy shift you and I had one time, where we had gotten an event and there were a lot of things going really wrong with this new admission, and I had a lot of questions, and you looked at me and you're like, this is a really great learning experience, but it's not a good teaching moment. Put your questions down and we'll go over it later. And we did. And I was like, oh, okay, note to self, I'm a hindrance to the process by speaking right now. I will just absorb everything. And then we unpacked it later. And that value of having a nurse that's willing to look at you and say, like, I can't answer your questions right now, just keep in mind, let's talk about it later. Let's go over it together later. Let's let's learn, let's engage.
Yeah.
And whether it's on the fly and you can do it in the moment, or it's later, I think there's huge value to that. And that's how we end up with young nurses who fall in love with cardiovascular nursing or nursing as a whole, and
Mhm.
the potential options that exist within that. It's by feeding them. So accepting that in the lifelong learning journey, we can't just be passive learners, and we
No.
have to share that knowledge
Yeah.
as we go, which your
And I think,
career path does that very formally. But to
right.
your, the idea of doesn't have to be formal.
No.
It can be pretty relaxed that way.
There's been a lot of little moments along the way, right, that I don't even recognize as a learning moment, or I couldn't even tell you about because it happened in the blur of a 12-hour shift, but I walked out of that shift smarter.
Yeah.
You know, and that's how it goes. So I think it's, yeah, I think it does kind of play out in an interesting way. So,
Yeah. What if you were engaging with young nurse Holly, or not even nurse Holly, young Holly, maybe
yeah.
you haven't even chosen to go into nursing yet, or you're thinking about it. What would you tell her?
Oh gosh, what would I tell her?
Yeah.
You know, honestly, I would just say stay the course, friend. Like, life's gonna take you in a direction you don't even see coming, and that's okay. Just ride the wave because you'll always land on your feet. Trust the people around you that will support you. Take the support when you need it, for sure. And yeah, just keep going because it's there's definitely been some moments where I've had to stop in my career and be like, why am I doing this? Like, why am I doing this to
Mhm.
myself? Why am I sacrificing so much? My friends are in Cabo having a good time and I'm home writing a thesis. Like, why am I doing this? And so you really have to just figure out why you want to do those things and stick with it. I'm really happy in life right now with the way it's turned out, and I've been so blessed with so many great friendships from nursing, so many great memories from it. I am, you know, I'm very comfortable in my life, and I couldn't have asked for anything better for the way it turned out. So there certainly was bumps in the road and challenging times, but you just gotta stay the course. So
That's awesome, Holly. I'm so delighted that your life is contented and pleasant and happy right now. It's hard, I'm sure, with thesis, and like you work a lot, you put a lot out, but that there's enjoyment in what you're putting out, and that it's not just a begrudged labor, it's a labor of love, and therefore
yeah,
there's joy in that. That's
yeah,
awesome. So
exactly.
how then has your career in nursing met or not met your expectations? Right, you came into it very pragmatic. Okay, this is what I need to do in order to feed and house my son. Right, so
Yeah, yeah.
have you fed and housed your boy?
Yes, he's fully grown up now. He is 24. He is a full adult. He's actually moved out a year ago. He has a house, he's got a mortgage, he's an adult. Like,
Oh no.
yeah, I don't know how I did that, but he turned out great.
Okay.
Takes a village. And yeah, so I've been very blessed with everything. And yeah,
It met
I've
your
met all
basic
my,
expectation, and
yeah.
then how has it? I guess oh my goodness, gone above and beyond your expectations, or surprised you in ways that you didn't really see coming.
I mean, I think this explains it the best. So I was at Canadian Tire. We all love a Canadian Tire a few weeks ago, and I ran into my grade 9 teacher, my homeroom teacher, and she was like, she remembered me because shockingly enough, I was a bit of a class clown, right? Like I was a giggler. I was a bit of an ADHD kid. You know, why would I sit still and pay attention when I could tell jokes and be funny? Um, so anyways, when she asked me what I was doing in life and I told her where I was now and how I'd gotten there, her jaw hit the floor and she was like, I never would have seen this for you. I was like, you know what, Jane? Me neither. But here we are. It's been a ride, you know, I'm just along for it. Um, so I think that was probably would sum it up quite well, is that like nobody saw this coming, but here I am. Um, I don't, I've never been one of those people that have had a solid life plan. You know, even being a teenage mom, I was like, well, I guess we're doing this now. Ignorance was bliss. I think I would be more of a hot mess if I was a mom now in my 40s if I then with my teens. But yeah, I think, oh, my dog's here. yeah, I think that I haven't had a solid plan. I've never really forced myself to stick to a trajectory or a timeline on anything. I've just been like, it's been a choose your next adventure, and that's just what I've done.
And
It works
open
for
to the
me.
adventures as you go.
Yeah,
In
yeah,
the last careers journey we did, there was a bit of a theme that aligns with that, where the three people that we spoke to, none of them had planned on being nurses when they were younger, and there was this element of like, well, just as long as you're ready and you say yes, like if you say
yeah,
yes to opportunities, then opportunities beget more opportunities, and if you're ready for them. So again, you can't just kind of sit around and be a subpar nurse and hope that opportunities come your way. You put effort out,
yeah,
and then as you put effort out, as you network with people, as you go to events, you rub shoulders with the right people, and they start asking like, oh hey, you should do your certification, and we have the study guide, and you can come and do it with us. And you rub those shoulders again, and then they're like, oh hey, you're doing your thesis, well I've got a thesis project for you.
right,
Right.
right.
Those opportunities start to come out of the woodwork because people have projects, they just need keen and exciting people to say, who are willing and ready to say yes. And then once you kind of get your foot in that door, and your first time, say, working on a research project, as coming from a clinical perspective, you have no idea
No
how to
idea.
start any of that. And then to
No.
have that guide walk you through their project or help you through your thesis project the first time, then
Yeah.
it gives you the skills to like say, okay, well now this is a question I have, or this is a project I want to improve on, or and you can do it a little bit
Yeah.
better, still with help.
And like what I've noticed is like people who appreciate people who say yes, and that's I've gotten as far as I am today because I've said yes. But they also appreciate when you say, I don't really know what I'm doing, but I'm here to help. And if you're willing to just point me in the right direction, I'll put in the work and I'll do it. And I just appreciate your time so much, right? And that's all that people want, is that collaboration. And for
Yeah.
you to just say like, hey, I don't know everything, but man, am I willing to learn.
Right.
So
And to your point, people are willing to share that knowledge, and it's just a matter of asking, because there's so many people out there who work, say, again at a bedside role, and bedside nursing. I love it, it's my jam in this stage of life, but sometimes you're like, okay, well I want to try something new, but you have no idea
yeah,
how, like, what is out there, how do you try something new, and that aspect of like, okay, we'll just go out and start networking, go and start going to like CCCN meetings, going to conferences, things like that, and you start again meeting those people, and then you learn what's out there,
yeah.
and you learn what kind of things you can do, and you find out what interests you, and you carve your own path. But yeah, there's it's a ride, to your point, but it's not a passive ride. I don't think you give yourself credit for the amount of, or you're not verbally giving yourself credit for the amount of work that you've put in. It's like the Flintstone car, it's a ride, but like you're doing all the work.
Yeah, yeah,
Yeah,
yeah,
along for the ride, but also you're the motor. So
yeah.
and hopefully you got some good friends who are willing to get out and push the car for you once in a while.
I've definitely had a network of people who have pushed for me every now and then. Yeah, for sure.
Yeah. Did anybody have any questions? Sarah popped on earlier. Does anybody else want to give any questions, comments? I have another photo to share if you guys are thinking about it. This is a photo that was a learning opportunity for Holly and I many moons ago that I like to pull up once in a while because it makes me laugh. There's the button. This photo right here. And this is a testament to how long Holly and I have been nursing. This is what our cat pictures used to look like a long time ago. This really detailed photo. And we've drawn that cat in, but when this patient came up with this picture, and it took 6 of us to figure out that, I don't even think we figured out. We had to ask the doctor what this one said. Do you remember? Did we have to ask him? We're
Yeah,
like,
I was like, what's a lazy cat thrombus? What's the lazy cat thrombus? And he was like, oh my gosh, he laughed so hard. He was like, hazy, calcified, CA plus.
Yeah,
We were
so I
sure.
took
Yeah.
a picture of that and save it for days where I feel like cardiovascular nursing is frustrating. I'm like, well, at least I don't have a lazy cat thrombus.
Right? Could be worse. Could have a lazy cat thrombus.
Could be
It does
worse.
it did look like a cat right there on the edge, and I thought it said lazy cat thrombus too. That's funny. Was
Right?
that Dr.
Oh,
Was that
That
Dr.
was,
Lach? Are you
it
allowed?
was Sarah. I was going to say
It
that was your
was.
favorite
It was
doctor.
Dr.
Handwriting.
Lachmania.
yeah.
Oh,
Yeah.
best! You
Yeah.
gotta frame that now.
That's
you-
just a bad photocopy.
No,
It
can
was,
you frame it?
I'll send it.
Yes.
Can I have a copy?
Yeah.
yes, absolutely. He laughed so hard when we asked him about it. He was like, I see what you're seeing now. He's like, but
Oh,
that's
yeah.
not what I intended, but
I'm
we
like,
laughed.
what kind of
I
lingo
didn't
is this?
know.
I know what a
I didn't realize his writing was that I could always
is
read
that?
his writing well, but I guess if he's in a hurry, it's harder
That
to
was like
read.
that was like a 4 a.m. drawing.
Oh yeah, it was
Yeah.
it was a late night cat, and
Yeah.
That's
Yeah.
touching too that it was his. I just guessed. Did you like how I could tell?
Yep.
I wondered
Yeah,
if you would.
just tell, yeah.
But yeah, so
Sounds
like these are the kind of fun learning opportunities we've endeavored on over the journey, and just by rubbing shoulders with the right people who you ask the question, hey, does anybody know what this says? And no one knows what it says. And then you learn that it's not some magic new thing like a SCAD or a POBA, or it's just a typo.
Yeah.
But yeah. No, yeah, Chris, what do you got?
Might be muted there.
My darn computer isn't working, so I'm on my phone.
But
So fascinating to hear your story, Holly. One of the questions I kind of had for you was, are there things looking back on your career that you wish you had said yes to? And are there things in your career that you wish you had said no to?
yeah. Um, I'm a big yes person, so typically that sometimes would end up in a bit of regret where I shouldn't have said yes to it. But uh, what can I think of? Really one of the biggest lessons that I've learned. The only thing I've ever said yes to that I really wish I hadn't was editing a textbook chapter. It was really cool to have my name in a textbook, but it took a lot of time and energy, and the return on that investment just wasn't really worth it for me. But it was good for my CV. So, but that's one of those like tougher life lessons where you're just like, okay, I've been there, I've done that. Maybe I won't do that again. But there's nothing that I actually like full on regret where I was like, oh no, I shouldn't have done that. And maybe it's just the way my outlook is, but I think that everything I've done has got me to where I am today. And my family says this the best way, that if there was a fork in the road and one pathway led down the easy way and the other was like the rockiest road you could possibly imagine, I will always take that rocky road. And I don't know, but it's just who I am as a person, and I don't intend to most of the time. So I think that part of that is because I say yes to a lot of things, but it's made it an adventure. So no serious regrets at all, really.
If I can add something, just being in research for my career and stuff, you probably will edit another textbook again. You say you won't, but this is academia now. You're in it now. So I know that we all say, oh, I'm never going to do that again or whatever. But yeah.
Yeah, I'm currently on vacation, so I've been trying to set boundaries and not check my email. But much to what you're saying, Sarah, there's a request in my inbox right now, so I'm gonna have to deal with that on Tuesday. So.
And if I may say, it gets worse, but like you like it, but it's because you know you end up doing it because you like what you do, which is, so it can't be all that bad, right?
No, I just grumble about it because sometimes it's tough. But yeah.
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 I like your bumpy road analogy, Holly, because I feel like you not only go down that bumpy road, but you will happily have a companion walk down. You'll invite anyone to come along with
Yeah.
you. A lost puppy on the way, and it's a bumpy road, but like it's you have the right company. So
Yeah.
it's still a fun bumpy road, and or maybe not in the moment, but later you look back and you're like, well, that was an experience.
Wow. Yeah.
But we'll keep with it, right?
Yeah.
Yeah, it's a bumpy road, but it's you make it a more fun bumpy road, which I
Like just hands up and wee.
like a good skill to have.
Yeah.
We're coming near our hour here. Anybody else have any other questions? I'm going to share another photo. This one is a photo that Holly shared with me, but because I'm a Luddite, I couldn't figure out how to use it or send it along for our poster earlier. Oh, now I've closed it. No, it's like I said, I'm a Luddite and don't know how to use technology. There it is. Now I'll share it with you guys. This is a really beautiful photo of Holly, and it's her headshot that we were going to use on a poster if I knew how to use technology, but I just thought I'd share it. It's a great photo. She looked very professional and friendly and welcoming. Exactly the nurse manager you'd like to walk into her office. Although I asked her many times to get a massage chair in her office and she wouldn't. So.
No, because everybody would just sit in my office in the massage chair eating my candy.
No one would leave.
No one would leave.
I
I'd get
still get
nothing done.
emails from that guy. If you ever go to CCS, there's a massage chair booth and he's trying to sell massage chairs to managers. Don't give him your email. It's been 10 years.
He still emails me too. Yeah. Found me on LinkedIn.
Oh, goodness. Any other questions here? Give it a second. Holly, while I give people a second to come up with their final dying questions here. Thank you. I always find you drop nuggets of wisdom along the journey, along the discussion as we go, and I often will think back to it later, and I'm like, that was a great point she made there. And I also really appreciate all the plugs you gave for CCCN along this way too. I will take this moment. I see you, Gina. I'm coming to you next to remind everybody that CCCN has many wonderful opportunities between like the study guide that we have, but we're revamping our mentorship program. There will be an email coming out in the fall and probably some Facebook or social media notifications of that, but we'll be looking for mentors and mentees. Again, this is another great way to like, you feel you have something to offer, we'd love to find somebody to share it with, or if you are looking for some help, maybe in your career journey, this is a great opportunity to get into that. So there'll be some communication from CCCN coming out about our mentorship program in the fall. Gina.
Okay, I'm not going to come on video because I just got home from a spin class when I logged into this. So you guys can imagine what I look like right now. But I just wanted to come on and say that Holly didn't mention how much of a mentor she is to other people along the way when she doesn't even mean to be, because I wouldn't be where I am right now if it weren't for Holly, because she took me in when I needed a new manager. And I was like, I'm in a vulnerable place as like a 2-year out newish nurse that needed a real solid place to be. And Holly's like, come over to CCU with me and I'll give you a place to go. So I just wanted to say that you touch people's lives more than you realize.
Oh, thank you, Gina. Oh, kill me. I might have feelings. It's going to hurt.
No,
thank you, Gina.
Dead on with that. To that point of taking people down the bumpy road with you, it's a pleasant bumpy road with Holly. It's a very pleasant bumpy road. When I moved out west, I wrote Holly a very sappy letter about how much I appreciated her mentorship along the journey as well. It's just like you say yes to opportunities that come your way. You say yes to people and questions that come your way too. And that in itself, for young nurses, new nurses, old nurses, all the nurses, is such a comfort to have a colleague that you know will say, yes, come, let's do it together, or yes, let's learn together, or any of those aspects, or hey, come do a CCCN meeting. Don't worry, you don't even have to join to start. Just come to our first meeting. Oh, you loved it? Come to conference with us.
Yeah.
Keep coming. Yeah. We're doing a soup sale. Come to our soup sale. And then it just spirals out from there.
Yep.
Well, thank you, Holly. And thank you, everybody who came and joined in. If you have feedback, feel free to shoot us an email on maybe what type of presentations you'd like to see in the future. I do have a lineup set up for the rest of the fall, but we'll be looking for some people willing to share their stories for the new year. If anybody feels that they'd like to share, again, we shoot us an email at info@cccn.ca. Holly, are you seeing some comments there? There's one from Bryn. Such an amazing, inspiring story. Thank you so much for sharing.
Thank you, everybody, for your kind words. I really appreciate it, and I appreciate you just coming to listen. And yeah, it's great. Thank you. So.
Thanks, everybody, and thanks, Holly. Have a good night.
Right. Okay.